My name is Sharon Lynch. I'm the HIV and TB Policy Advisor for MSF, which is Doctors Without Borders. Today we revealed some startling information from some of the hospitals where we work in different contexts in sub-Saharan Africa. What we found in these hospitals is a startling number of patients who are living with HIV and who have been on ARVs. So first of all, we have tremendously high mortality rates among HIV positive inpatients. We are seeing that 30% of HIV positive inpatients die. 30% of the patients that die within 48 hours of admission. Now, in terms of people who have been on antiretroviral therapy, 50% of the HIV positive inpatients in the hospitals where we work, in sub-Saharan Africa, where we looked at a particular cluster, 50% have been on HIV therapy for more than 6 months. So obviously these people are failing, treatment is failing them. And what we need to do is to put steps in place so that we can better detect problems and prevent treatment failure. And certainly, if we reach more people with treatment earlier in the disease progression, then we can also prevent development of AIDS. We see that people are dying of opportunistic infections because HIV and the development of AIDS has weakened their immune system to the point where they are more susceptible to developing and dying of TB, the #1 killer of people living with HIV, more susceptible of dying of cryptococcal meningitis, and the second most prevalent killer of people living with HIV behind TB. So if we have these steps in place, if we test and treat people earlier in their disease progression, if we better diagnose TB using the tools we have today, and of course if we implement the package of care that the World Health Organization has just released in terms of better supporting people with AIDS, with advanced HIV, then we can stop some of these deaths. Thank you.